I was diagnosed with histamine intolerance in fall of 2019. I have also been diagnosed with Ehlers-Danlos syndrome, but I do believe the root causes for the histamine intolerance are a combination of MCAS and PCOS, neither of which are diagnosed, but MCAS has been linked to Ehlers-Danlos, so it's a pretty good bet for me. The PCOS, based on some of the symptoms I have hormonally. I wanted to do an update on the supplements and vitamins I am taking. I did another video in fall of last year, and things have changed a little bit as I continue to research. I am not a doctor. If you have a good doctor, highly recommend you seek out medical help. I'm going to break this down into what I take in the morning and what I take in the evening. In my last video, I know I was still taking slippery elm, and I was actually taking that an hour before I took my morning group of vitamins and supplements. Slippery elm helped greatly in protecting my intestinal lining as I was trying to rebuild and fix the leaky gut issues that often contribute to histamine intolerance in one way or another. I kind of took a three-pronged approach to that. I was taking slippery elm. I take natural mast cell stabilizers. At that point, I was taking lemon balm. I'm currently taking Moringa. And then I have also gone to a low lectin diet, which I can't say it will work for everybody. I'm sure it won't. But it has drastically helped me. And the reason it helps is because by killing off or eating foods that are low in lectins, I don't have that pressure on my gut, because the way lectins work is they basically make the junctions between cells loose so that it's easier to tear holes and larger particles get into your bloodstream. Once particles are in your bloodstream, mast cells will attack them. Because, well, I guess they don't really attack them. The mast cells degranulate and signal for other immune cells to attack them. Well, when mast cells degranulate, that releases not only just histamine, but also a bunch of different hormones. And so then I would get histamine reactions even to low histamine foods because they were high lectin, if that makes sense. So for me, a low lectin diet has helped. That was sort of my three-pronged approach to dealing with the mast cell issues, was slippery elm to help coat as I was healing, a natural mast cell stabilizer to kind of calm the mast cells down, and then also eating low lectins. Now, I still eat low lectin. I have worked my way off of the slippery elm. I took it for about 6 to 8 months, and then I tapered it down so that I was doing every other day, and then every 2 days, every 3 days, until I just wasn't taking it. I take turmeric, 1,400 milligrams a day. I do capsule this one myself. And this basically replaced my arthritis medication, because the last time I went to my rheumatologist, because I was having joint pain and stuff, which is common for an Ehlers-Danlos patient. When I was originally diagnosed at 15 or 16, they started me on arthritis medication for the pain, and I was on the same dosage of medication at that point as my dad was at the time, and he was 60. That's just kind of how that, at least at that point, was treated. I take turmeric basically as an anti-inflammatory to replace the arthritis medication I couldn't take. I take a B100 Complex. This does also help with pain levels, although I'm not quite sure why. It is one of those things that is often low in histamine intolerance patients, from what I can find, but not all of them are typically low. It's just certain B vitamins. The best way I found to get those B vitamins, though, is to take an actual whole complex. It seems to vary from people I've talked to as to which ones we're low in. I want to say I'm low in B1 and B6, but it might be B3 and B6. I don't know. I haven't looked at my test results in a while. So anyway, I take one of those a day. I use vitacost brand. Overall, vitacost has been a really good source for me with good quality products, and I would still be taking them if I wasn't capsuling myself. It is just a whole lot cheaper if I capsule things myself, so that's why I went that route. I will put a link to the things that I'm taking and where I get them if I can in the description box down below. Horse chestnut extract, I take 200 milligrams some days. That one is supposed to help with like veins and blood vessel tone, I guess you could say. I really only take that when I'm having certain issues. Rose hips, I take 1,000 milligrams a day in the morning. If you haven't heard of rose hips, it is a natural non-citrus form of vitamin C. A rose hip actually forms at the base of the rose flower on like a rose bush. I take 1,000 milligrams of that, and I think the last bag I was able to get, I'm running those through the coffee grinder to powder it and then capsuling it. And that has worked really well for me. I know some people that have salicylate issues are not able to take rose hips. Moringa. When I made the last video, I was taking lemon balm, I believe. I was only able to take 2/3 of the dose that was recommended on the Vitacost brand bottles of lemon balm, because taking more than that would cause migraines for me. It was definitely more finicky on the dosage. I stopped taking that because I found a reference somewhere that it could possibly cause problems with thyroid absorption. I had no idea because I had started taking lemon balm on a Hail Mary based on an Amazon review of all things. But it had worked to deal with my vertigo. So is it worth a try if you're having issues? I would definitely recommend it. I did go off of it, and I have not had any problems. I haven't noticed anything necessarily better thyroid-wise either, though. So that's what I was taking. I am currently taking Moringa. Definitely not as finicky on the dosage. I take 1,400 milligrams in the morning. I also take another 1,400 milligrams at night. This drastically helps with itchiness for me. That's the main symptom I notice, and I'm going, oh, I haven't taken my nighttime stuff yet. Or I don't typically wake up to itchiness, but like I'll notice if I haven't taken it. Now Moringa, there's pluses and minuses to all the things. Moringa also helps regulate blood sugar. So if you have your blood sugar and stuff regulated already, just be aware that it can lower your blood sugar. I do take Moringa 1,400 milligrams in the morning. Astragalus Root it's kind of one of those things that has been hard to get my hands on this year, but I have been taking it for quite a few years before I had ever even heard of histamine intolerance. It's one that I was taking to help my body sort of deal with stuff that it was reacting to in my environment and food that I couldn't really figure out why. It is sort of a deep-seated immune booster with a whole host of properties. So, like I mentioned, it has been hard to get a hold of lately, but highly recommend it if you need to help boost your immune system. And I take 1,400 milligrams a day in the morning. That's 2 of the 00 capsules if you're trying to keep track of that. I take Peppermint. Now, when I was originally diagnosed with the histamine intolerance, this one was actually, Peppermint was not recommended. Spearmint was recommended to help deal with unwanted facial hair. The way she explained it was that it helps keep the testosterone pathways clear and deal with androgens. I don't know if I'm pronouncing that right. But anyway, it helps with that. I happen to react to spearmint. I have spearmint growing. This is how I found out I was sensitive to spearmint. It had never really made me feel the greatest when I try and drink spearmint tea and such, but I actually rescued a plant at a local shop that had, I don't know how it ever came back, but anyway, it came back with a vengeance. I think they wound up giving it to me for free or maybe a quarter or something, and now I have like a patch of spearmint like this, but every time I'm pulling spearmint out or picking it for other people, I am broken out in hives and things. So Peppermint has the same constituent that spearmint does, just slightly less. So I am taking that in place of that. It doesn't work as well as I'd like because I do still have some issues, but I don't think it's not doing anything, if that makes sense. I'm also taking milk thistle, and I take 700 milligrams a day of that in the morning. And I started this in mid-September to help support my liver. I was kind of to the point that I've pretty well got the mast cell related side of my root causes and stuff down. The histamine intolerance is under control. I pretty much have to eat really stupid for about a week before I start having pretty much any symptoms at this point. So I kind of felt like it was time to start working on the hormone related issues that I have honestly had since before the histamine issues. So milk thistle was sort of my first delving into that, because what I was reading about was your liver and the way it processes estrogen. Basically all of your estrogen has to detox through your liver. There's a wide variety of stuff that your liver does as far as detoxifying, and I felt like this was a good option for me. Not saying it's a good option for everyone. Trust me, I have researched lots of things that I have decided were not good for me. I have tried some things and quickly found out, yeah, that's not a good choice. Make sure you are doing your own research. So anyway, I take 700 milligrams of milk thistle. Now, around the time I started taking milk thistle, I did start feeling tired and fatigued after a couple weeks. It was not the milk thistle, even though I was seriously thinking it may have been. I actually came down with the current crud in October, and that had me down for most of the month. And then coming out of that, I've actually had more energy than I had before going into it. So I do definitely feel like that has helped. It has also, I don't really know how to explain this, but like, so I still have fat around my midsection, but it feels like the muscles in my midsection are tighter. And I have no idea if this is how this actually works, but it just feels almost like it's gotten rid of marbling in the muscles. And like I said, I have no idea if that is how that actually works. But it just, the muscles in my midsection feel like it's actually doing something. So I don't know how it works exactly. I know that it is supposed to help detox estrogen. I was estrogen dominant when I got the hormone stuff tested. And if you don't have a doctor that is willing to work with you and help you with testing and stuff and you want to know, I typically use any lab test now. I know that there's at least one other one that doesn't necessarily have to have a doctor's order to do the testing. I've never used that one. I use any lab test now. If you've watched my other video, you probably realize I'm no longer taking Oregon grapefruit or D3 in the mornings. And I'm actually no longer taking Oregon grapefruit at all. That started, I had a cat named Miss Pink. Well, her name was Pinga. Anyway, she did pass away in October, but she was also diabetic. And at one point she developed a urinary tract infection, was having trouble going pee. I got her some treats to try before taking her to the vet because vet trips are were very stressful for her. In the process of all this, realized that one of the main ingredients in this was Oregon grapefruit. It did help her. It also threw her sugar off. She started refusing to take her insulin in the evenings. And when I started looking at that, the reason I was taking it was insulin resistance. It was one of them when I started researching the PCOS side of things. The vast majority of people with PCOS have a type that is related to insulin resistance. I am over 300 pounds, have been borderline diabetic on multiple occasions. I do have trouble losing weight. One of those things where the Oregon grape, my hope was that it would help regulate the insulin and that kind of thing. I did not actually notice a difference. I was taking it in the morning and at night. I never got above half the dosage recommended, mainly because I already have trouble with hunger cues and things. Like, I don't typically get hungry like most people. So the fact that it would suppress hunger was not necessarily a good thing for me, because even when I was trying to do medically managed weight loss, it was one of those things where on more than one occasion they would say I wasn't eating enough calories. I would eat all day long, but it was healthy stuff, so it wasn't high calorie. I did quit taking Oregon grapefruit. I started at night because I noticed I was getting up multiple times a night to go to the bathroom. And once I put that together with the urinary tract infection treats for my cat, I'm like, oh, that might not be a good idea. So I stopped taking it at night. And then when I had such good results with the milk thistle, and they kind of overlapped in what I was reading, because milk thistle in some ways affects, I don't know if it's directly affecting the insulin or if it's affecting the insulin because it's detoxing things in the liver. But then Moringa also lowers blood sugar. And a couple things I take actually help lower blood sugar and inflammation and things. So it just seemed like I wasn't noticing any difference specifically from the Oregon grapefruit. And it just seemed like another pill, and it wasn't really doing me any good. So I stopped taking that in the morning after the milk thistle had time. I did stop taking D3. If you've been around a while, you probably realize that I had some problems with vitamin A. I was getting blisters on the roof of my mouth. Well, since that point, I guess I should say, I started taking a vitamin A supplement to get the vitamin D because I couldn't get the vitamin D I was used to last summer. Just shortages and things. People, the places that I was looking, nobody ever had it. So I taken this vitamin A supplement without researching the vitamin A. And blisters in the roof of your mouth are actually a sign of too much vitamin A. I've sporadically had issues with blisters in the roof of my mouth since that point. Anytime I've drunk large quantities of milk again, or green leafy vegetables, broccoli, kale, not cauliflower. I don't like cauliflower. Lots of salads or Brussels sprouts, anything like that, eating too much of that, I start getting blisters again. So I've just discontinued the vitamin D3. I do try and get outside a little bit, but overall, I don't think I'm terribly deficient in it at this point like I was when I started taking it, and I haven't noticed any ill effects from just not taking it. Those of you that are dealing with histamine intolerance, though, if you don't have some reason that you specifically shouldn't take it, it is one of those things that's sort of a building block for the DAO and thing. At nighttime, I take another 2 capsules of the Moringa, another 1400 milligrams, and I will notice if I have not taken it because I do start having itchiness. I will typically start having itchiness around the time that you would expect the histamine dump to be in the middle of the night. So I do have trouble sleeping if I don't take that again in the evening. I also take MSM, that is methylsulfonylmethane. I started taking it for another issue that it didn't really help. I did find that when I started taking it, it would help. Only taking the turmeric in the morning, I noticed I guess I didn't really notice until it was gone. I will often have pain in my hands and stuff at night, and the MSM actually helps that. So I take 1,000 milligrams of that, or 2 of the zero-size capsules. Kelp, I take 700 milligrams, which is 1 double-zero capsule, and that is a natural source of iodine. I do react to iodized salt. Seems to be pretty common. I don't know if it's the processing or what, but it will cause histamine in my system. So I don't do iodized salt. I do pink Himalayan, and I take a kelp supplement. Also take selenium, 200 micrograms. Kelp and selenium, I have been taking those for years, even from the point I had fibro symptoms. Once I went through all of the symptoms in this book and treated everything, the only thing that never really resolved was a full recovery from the thyroid stuff. So I have been treating thyroid stuff for about 14 years now. When I've requested things be tested, my doctor would test TSH. It's within normal levels. There's nothing I can do for you. But yeah, you have hypothyroid symptoms. I've heard that from naturopaths. I've heard that from medical doctors. I've heard that from rheumatologists. I've heard that from pretty much everybody. None of them would actually test past the TSH point. So that's just one of those things. I don't know. I deal with it. I don't know. I'm hoping that once I get some of the hormone stuff situated that I will notice a difference there. And the other one I take is zinc, and I take 50 milligrams about every 4 days. Why 50? Because that's what I could get my hands on in the shortages in the last 2 years. Brand I am taking, I actually react to because it has whey and something else that I actually have sensitivities to, but because I do need some zinc supplemented, I am still taking it. I'm just spreading it out, and I'm I don't know. I don't need 50 milligrams a day. I'm just spreading it out, and that has worked well for me. Probably not ideal. I know before, when I could get it regularly, I was taking 30, but that is one of those things I have started taking since the histamine intolerance because it's one of the building block portions that you need for the DAO and such. Also, since I got sick, have been eating 3 to 4 bananas because my potassium levels have been low. And if you're wondering how I know that, I got very dehydrated. Like, to the point I was drinking a gallon of milk and half a gallon of water a day, and I was still thirsty constantly and still feeling dehydrated, still constipated and that kind of thing. I was using magnesium lotion daily right then, and I still use it 2, 3, 4 times a week. I knew it wasn't likely magnesium. I was drinking a gallon of milk, so calcium was not a likely choice. And at the time I was eating more convenience foods, so higher levels of salt, and that should have sort of mitigated the sodium factor. So I started eating bananas, even though they are high histamine. Sorry guys. I don't actually react to bananas. And honestly, even when I was really bad histamine-wise, I could still eat bananas. They're low lectin. So my mast cells didn't go crazy over bananas. I will eat 2, 3, 4 bananas a day, and that has drastically helped the dehydration. If you have questions, comments, feel free to put them all in the comments down below. I will answer them to the best of my ability. I am not a medical provider. I have no formal training in herbs or anything else. It's just the research I've done for myself and what's working for me. Like I mentioned at the beginning, I am an MCAS, PCOS, root cause sort of situation. And if you have questions, maybe I can help point you in the direction of where to look.